Hello and welcome to the National Library Singapore's signature program for conversation. My name is Ashif from the National Library's engagement team. There's always something to discover at the library where we seek to ignite passion for learning through our collections, services, and programs. For Conversations is where we bring together thought leaders to share new possibilities for the future, inspire lifelong learning, and the creation of new knowledge based on the theme New Thinking for a New World. Over the last conversation, our local and international speakers discussed the changes in the future of work. And for the next 2 days, they will break down the changes in our well-being, the art scene, and development of urban design. And to kick off the second conversation on living with the pandemic, we have Ms. Melissa Kwee, who will be moderating this session. Melissa is the Chief Executive Officer of the National Volunteer and Philanthropy Center in Singapore. As part of today's conversation, we have specially put together a resource guide that you can refer to if you would like to learn more about this topic. And you can access it through the QR code and the link that we'll be putting up later.
Hello, everyone. Really happy to be here with you today, and happy to be joined by two fantastic guys, Professor Debanjan, my friend from SMU, Professor of Psychology, and Dr. Debanjan, Banerjee, who is a psychiatrist actually from the National Institute of Mental Health and Neuroscience in Bangalore. So welcome to both of you. So today our topic that we're going to be discussing is about living with the pandemic. And I think that as most of us are aware now too, that this isn't really going away anytime soon. And really what that means for us is that we need to find ways to understand, learn wisdom. How are we going to best deal with this pandemic and really just carry on in the time that we have? How we develop new routines, maybe new habits, new mindsets, new skills in this whole situation. So that's what we're going to be doing actually today with David and Debanjan. So a lot of knowledge and wisdom to share there. And maybe just before we do that, I think maybe I'd like to ask both David and Debanjan one question. And that is, out of your very illustrious CVs, what is one thing that is not on your CV that we might want to discover about you today? So feel free, anyone.
All right, since I'll try. One thing that is not in my CV that you want to know about? Well, I'm not sure what you guys want to know about. I guess the thing that is not in my CV is I was a police officer about 3 decades ago. I was in the police for 9 years. I'm not sure if that is in my CV. But being the police officer, of course, make a world of difference to my life. Started the police when I was 18 years old. So you get to meet people of different walks of life, attend different cases, enter into people's crisis moments. I guess that has kind of changed my worldviews growing up. And that kind of affected the way I think, the way I feel, and the way I behave, even in academia or as a consultant or as a writer or as just a human being, I think.
So that investigative, curious, and down-to-earth, walk the streets kind of background then. Yeah, that's so true. How about you, Debanjan?
Oh, yeah, it's a very nice question to ask, Melissa, you know. There's always something about all of us which is not present in the CV. So I think there's been a lot of academic writings over the last probably, 8 months, a year, but then I love to write. I write a lot of stories and I love to paint. That's probably two of the most, passionate hobbies that keep me going. And that's a wonderful stress buster. And I think I owe a lot to my composing and painting that things have been a bit better during the last 8 months of crisis.
Yeah. Wow, that's huge. Actually, that's so That's so important, and I think we will get to sort of the question later on in the session. You know, what are the kinds of things that we can learn and do to adjust as individuals, actually, to COVID-19 too. So maybe one thing that I'll just share about myself too is actually I'm not in my office, which technically this little virtual screen looks like. I'm actually in a hotel serving quarantine. I just got back, I think I'm on day 4 now of my quarantine from visiting my 100-year-old grandmother in Los Angeles. Oh. And I just declared that my essential, non-essential travel, you know, to go and visit her, because she's 100 years old and she'd lost all this weight, you know, during lockdown. And, you know, I just thought, my gosh, you know, I somehow have just got to go and see her and check in, she's okay. So, you know, I did all the mask and the sanitizers, and, you know, I even wore gloves, you know, going through the airport and things like that too. So, you know, life is definitely very, very different as a result. So I think that's kind of what we're going to talk about a little bit, you know, today too. How has this really affected us? But maybe before we do that, let's actually just tee off with a little bit of a poll. Let's actually know who's in the room and what's really on your mind, actually, too. So let's get that question up there so everyone can answer the question. What's been the biggest challenge for you during the COVID-19 outbreak? And I think that the questions there are you know, addressing us as individuals. But I think, you know, COVID really has revealed so much about society, actually, too, and just all the different issues that have really been uncovered, you know, during this time too. So we'll be able to kind of discuss that as well. What are the kinds of things that how would you answer this question then? I mean, for both of you, what for you has been the biggest challenge in this sort of time? Staying mentally, emotionally healthy. I don't think you're going to lose your jobs. Getting infected, dealing with grief, trauma, or loneliness, which I think has really become very real, or just even adjusting to working from home.
I think I'd connect the first and the third. You know, loneliness, especially getting socially disconnected, which has been like so unprecedented for all of us. That's definitely linked to both the mental and physical well-being. And, you know, segregated from the family, especially working in a hospital setup, even though you know that it's a part of the professional risk, that fear always stays that, you know, if you get infected, it's not about you, but you can get the infection back to your family members. Yeah. You know, and your loved ones. Yeah. So I think that's been a real tough thing, and probably that's also been an eye-opener for me personally. You know, so none of us expected this when this year started, and every day, especially during the lockdown, getting worried about your family who are far, whether they're doing fine, becomes a major challenge, and that keeps you concerned all throughout. So it's between balancing your own well-being versus worrying for others and staying socially connected.
Yeah, that really, yeah, that's so true. Oops, I think.
Yeah, I think without the poll results.
We saw the poll results there. But just before we go there, David, what would you say would be your kind of biggest challenge for you in this season, though?
Well, I'm not too sure myself, but I think in the beginning it was like most Singaporeans here, when there was lots of uncertainty, it was a fear of getting infected. I think at the first few months, definitely from late January, even all the way up to the circuit breaker, I think sends a signal that it's pretty serious, that, oh, everybody should stay at home. So I think the knowledge of the knowledge of the uncertainty, actually, as well as the policy being implemented, actually, rightly or wrongly, have caused all of us to have that fear of getting infected. But I guess once things stable down a little bit, once the numbers get clearer, once we get more and more knowledge about what the virus is about and what precaution steps that we can take, I think then the concern or fear of getting infected kind of goes down a little bit, quite substantially for some. And then I think the emotional part, like what Debanjan said, the emotional and the mental part comes in. Not so much of a serious mental well-being situations, but I think probably still a lot of uncertainty of what does that mean, when is it going to end, what about my close friends, are they doing okay, should I check in on them or should I leave them alone? I think those things matter.
Yeah, absolutely. I think if we pull up the poll results again too, the first one that we're sort of seeing there for 55, over half of us actually just staying mentally and emotionally healthy ourselves, just caring for our own well-being actually has been the biggest challenge for us. Second, followed by then the fear of getting infected. And I suppose, there's two sides of that. There's the fear of getting infected and the fear of infecting others, as you mentioned then too, Debanjan. I was so afraid actually too, going to the United States, traveling to see my 100-year-old grandmother, that I was going to infect her. And the last thing you want to do is travel and kill your grandmother. I mean, like, can you imagine, right? So
I hope she's fine.
She is great. I went and I got the test. I got tested and I did safe distancing. I wore my mask. I tried to do everything that was appropriate actually to keep things going. So, but do the results there surprise you in any way, or what do you think is beneath actually just that issue of just feeling mentally and sort of like socially well?
Well, I think first thing about the results, I think we want to be clear that this is not a scientific survey.
Oh, it's a poll.
Yeah, it's a poll for us to kind of get started. So we need to be quite clear, not to worry too much about the percentages, which is high, which is low, and so on. But at the same time, I think making us reflect, I think it's a good exercise for us to start off this session and think through and try and recollect what happened. I guess when we first started the first few weeks, what bothers us most and what bothers us now, for many of us, probably going to be quite different. And moving into the future, what will bother us and keep us occupied, I think will also be different. So I think as far as I'm concerned, the first thing about such, not such polls, but the first thing about such reflection is that it is pretty malleable. It's a very dynamic situation. It is unpredictable. It also means a lot for our decision making, because if we are going to make our decisions with how we always feel right now, it could well be quite different, including how we feel, say, in a few weeks or a few months later. So I think those issues, the poll for me is a good exercise for all of us to reflect and, in fact, retrospectively, try and remember what you feel at the beginning, what you feel now, and what you and your loved ones might feel, say, in the next few weeks. And I think that gives us put things in perspective a little bit.
Yeah, so to kind of chunk up the time a little bit so it doesn't just feel like this interminable sense of don't know where things are, where things were. No, I think that makes a lot of sense. Actually, David, you talk a little bit in one of your articles about how to make decisions with this climate of ambivalence. We're just not sure. Like we're told that it's going to end at some point, but maybe there isn't a post-COVID world. Maybe we're just supposed to live with this in some way, shape, or form for some undisclosed period of time. How do we make decisions in seasons of ambivalence?
I think you're referring to the Straits Times article that probably came out, I think, was it late June or early July? I remember after the article was published, it goes something like how to make decisions amid the COVID pandemic. I got so many messages and emails and said, is this, are you teaching us how to make decisions because he was going to vote? People were going to general election and vote at the same time. I have to be quite careful and say, well, if you read through the entire article, the word election did appear only once out of about 1,600 words. So no, it is not just about voting. Of course, you can apply it to voting. And I think the main point, if I try to recollect what the article was trying to say, is that when we make decisions, we are driven by various things, right? By our rationality, but our emotions, but also the here and now, during that time where what's the context, who are the people around us, which issue that dominate, and so on. Psychology tells us that we tend to be less affected in our decision decision makings by the future, because many of us are not very future oriented. You know, we tend to discount the future and think about what matters immediately, right? You all know about the simple experiment that if I were to give you $10 right now versus if I give you $20 1 month later, actually rationally you should choose 1 month later because the $20 is still there. But all of us, most of us would choose the $10 right now, even though you are pretty sure that 1 month later you will get your $20. So that kind of goes to show that many of us, when we make decisions, we are human. We are affected by, I wouldn't call them biases, but we are affected by human predispositions and tendencies. So the first thing to really understand is to have some insights of how we as in human function. I think it'll be very, very helpful. And then of course, try to set goals and ask yourself, what are the goals when I make a decision? What are the values that matters to me? So that when I make this decision, is it really congruent with my values? Because sometimes your emotion may not be congruent with the values that really matter to you. And then of course, your expectations must be quite clear, you know. So think about your goals, your insights about yourself, the values that guide you, and the expectations that you have, you know. So GIVE, give, right? Your goals, your insights, your values, and the expectations.
So those are the things that you kind of have to go back to remember the sort of fundamentals, you know, around that. But I'm just wondering, you know, Debanjan, I was reading a little bit about some of what you've been writing about too, and read a somewhat, I felt, frustrated article actually that came out in Indigenous, you know, too, that this whole, you know, this visibility that we're sort of having now around mental health issues, because, you know, it just seems to affect us all in some way, shape, or form, is really going to be kind of a passing thing. Like you felt like, you know what, it might just come and go, and people aren't really going to be taking notice of the more fundamental and deep-seated, deep-rooted issues actually in mental health. I mean, can you say a little bit more about that? What do you think needs to change?
Yeah, I think I'm going to refer to what David was telling about reflection. So when I wrote that in Indigenous, it was more of a self-reflective piece. You know, I was just looking back at last 8 months and the crisis calls that we have been getting as mental health professionals, the immense amount of literature that has been growing related to mental health and, you know, our psychological well-being. And as David was mentioning that, you know, it's not always possible to take things at just the gist of the face. You know, mental health or psychological well-being, obviously this is an unprecedented circumstance. I mean, if somebody is not anxious during the pandemic, that's probably something that's abnormal. You know, anxiety acts as a defense mechanism. So it helps us prepare probably, and that's been there. This is a lot of talk has been there related to trauma, you know, and complex chronic trauma. And as I mentioned even before, and in that article that you're referring to, pandemics is not a one and go phenomenon. You know, like any natural calamity, like earthquakes or, you know, war or something like that. But it goes on, it passes on. Even till now, we don't know that what's going to be the post-pandemic aftermath, what's going to happen after 3 months, 6 months. So I guess the same issues that we have been discussing all this while in the last 8 months about mental well-being have always been important. But, you know, it's somewhat ironic that a virus or a pandemic was necessary as an eye-opener for us to understand that how important psychological resilience can be. And if you even go to the policy levels, I mean, it can be an individual level right to the administrative level. Health is one, you know, and be it a physiological health or psychological health, they have a unique bidirectional relationship. One is not possible without the other. So in that way, it even helps you staying prepared for what's going to come. It helps you in the preparation of your uncertainty.
Yeah.
So that's a concern that whether, you know, once the crisis goes down, there are some useful lessons that we have all learned from this pandemic. Certain things which have become our priorities, like the poll, you know. So, you know, if those things continue, those are habits worth persisting, be it a pandemic or not.
Yeah, absolutely. And how do we do that? Part of that is just stopping to kind of reflect on some of that too, right? And that's what you're saying. You know, I feel like what you're also talking about is kind of about the perspectives, you know, that we have. And I suppose, you know, for so many of us, actually, if we're even on this webinar today, we count ourselves amongst the privileged, because COVID has really wrought just great havoc upon so many other populations, actually, too. What would you say have been those major issues or challenges that you've sort of seen, perhaps in Debanjan's case, the Indian context, and David, you know, for you observing that in the Singapore context?
Well, I think, you know, what we have been working on and referring to multiple times in our write-ups, there have been certain papers or certain pieces, probably when the lockdown started, roughly in the beginning of the March to May period, which mentions COVID as the great equalizer. Now, I always had, you know, quite of, you know, I oppose this term because I really don't feel that it's really equalized. But as you said, especially in Indian context, it being such a populous, a socio-culturally diverse country, you know, it's and we all know about the number of languages, the traditions, it's so varied. And also if you see the socio-economic curve of it, it's, you know, it's quite varied. You can actually swing between poles. So in that way, I think COVID has really brought about, it's really disclosed the crevices, the socio-economic disparities that have been there between the classes. And that's the context to mental health, you know, that it's very, very individualized. Yeah. While for some, it might be a panic of not getting the sanitizers in market. For some, it might be just not getting enough food to survive on the streets because travel has been restricted and they are not about to go back. In fact, I keep referring to the significant amount of a migrant population, the daily wage workers who were stranded once the lockdown started. Now, the lockdown was necessary. You know, it was really needed to curb the pandemic, the ongoing cases that were happening rapidly. But then at the same time, it was sudden, and a lot of people had to walk for miles bare feet. They were stranded from their family. For them, the definition of mental health was equated to the definition of home. And by home, I just don't mean a shelter, but, you know, at least a safe place where they can be with their family. Yeah. And, you know, it was really there were very tragic scenes when people were overcrowded, stranded in stations, stranded beside railroad tracks, having no place to go. Now, as much as the basic amenities of life get threatened, you really start questioning that whether mental health at one time is really about an existential threat. You know, so while we have the luxury to think about if we have enough social distancing, for some people, social distancing itself is a luxury.
Yeah, that's right. It's just not an option.
So I think the disparities have been uncovered quite much by the pandemic. And that's probably one of the lessons that all of us can understand and take forward, you know, because we talk about collectivism, we talk about that quote unquote, we are in this together. But the question is, are we? And if we are, then I think we can mutually support each other, probably the less privileged classes. And that's one of the way how a collective resilience can form, not only for COVID-19, but for any such futuristic crisis.
You know, it's funny when you're absolutely right, and just this whole sense of the things that we can now not unsee, the things that were just occurring.
I think that's beautifully put. What we cannot unsee.
Yeah, beneath the surface, and how we can then respond to it. How it provides, I think, us too with a sense of
responsibility.
and responsibility actually to that. You know, I'm going to flip the question actually over to David too, and just ask you, you know, when someone, it's hard to compare pain, right? I mean, like I think Debanjan said, you know, for one person it's not seeing their family. For another person, it's feeling, you know, enclosed or not being able to breathe in a confined space or something like that too, right? But is perspective really helpful actually for us in shaping and building this mental resilience, or is it, you know what, that's just somebody else and that has nothing to do with me? How do you understand this question of perspective? Are we able to be empathetic when we're in pain?
Well, I think if I understand you correctly, you're trying to get at the issue of perspective taking. Not just perspectives, but perspective taking. Now, some people call it empathy, but empathy is just one aspect of perspective taking, right? Because perspective taking is multidimensional. I could very well know what you are thinking right now, but I could actually don't feel what you feel. So the kind of empathy has with it a very much form of emotional kind of involvement. When I begin to feel what you feel. But perspective taking is much broader than that. It can involve empathy, but it need not be just empathy. It can be cognitive. It can also be something to do with no emotions at all, right? It's about whether I can put myself in your shoes and look at things from your perspective. Now, perspective taking is very, very critical. In fact, all psychological research has shown that without perspective taking, you are very, very likely to run into a lot of counterproductive behaviors. You'll be a bad leader, you'll be a bad team player, you'll just be a bad person to be with, right? Because you fail to see things from people's perspective. Now, able to see people's perspective doesn't mean that you have to agree with them, because some perspectives are either bad, not your values, or they are just simply wrong. But sometimes they are right, sometimes they are not totally right, but they give an added information that will help you to make better decisions. So that is something that's very important for policymakers and leaders, especially. When I say leaders, I really mean not just organizational leaders. Could be you and I leading a small little group, a small little team. It could even be a counselor, a social worker, or a psychologist, or any professional, or a nurse at the dorm, you know, trying to manage a situation with the migrant workers and so on. So when you're in those situations, if you fail to take the perspective, you actually get angry very easily. You argue with that person, and you feel that you have so much that you disagree. But if you begin to take the person's perspective, then you'll be able to find and try to locate what are some of the commonalities amidst the differences that you might have, even the disagreements that you might have. And even with the differences that you might have, you will be able to see what are some of the differences that can actually complement each other. So that is not just a skill, but it is also a mindset that takes time to develop. I should say something about this, because I think what Debanjan said about a disparity, of course, disparity exists in every society, but the way it is manifested can be quite different. Like Singapore is very fortunate. Like Singapore overall is a pretty rich country, and so that our poor, it is still relatively speaking pretty rich, if you like to use that word, vis-a-vis other countries. But having said that, if you fail to take perspectives of our lower income households, and if you keep telling our people that, oh, don't worry, you know, our poorest are still pretty rich compared to the entire world, you miss the point. Because that is not the yardstick by which our lower deciles of income will evaluate themselves, right? It is a relative thing. And they begin to say, well, what am I capable of in a country like Singapore? I should be here, but I'm here right now. So that requires a kind of perspective taking, not just from policy makers, but from you and I. Since we are talking about mental well-being, I thought maybe we should make this also pretty concrete, right? Now, let me give you a very simple example. All of us use WhatsApp. All of us have some WhatsApp group, and most of us, I wouldn't say all of us. Now, how many times each one of us in our WhatsApp group complain that because of COVID, your holidays are messed up? How many times we complain to our group that, oh, I wish I should be traveling, I should be in Bangkok now, I should be in China, I should be in Japan, you know, I should be sipping my champagne right now. Now, when we do that, it is pretty okay to do that with people who also travel a lot, with people who are your very close friends, who know where you are coming from, that you are feeling isolated, you're feeling difficult and so on. But you could be in a WhatsApp group where there's somebody who just lost their job. It could be in a WhatsApp group where 1 or 2 persons of them are dealing with a grief situation because the family member has passed away due to COVID, or a very close friend has passed away. Right now, the number of cases might be small in Singapore relatively globally, but the number of people who are affected economically, financially, socially, through family, it is quite huge because you multiply by number of times. So that is the small little things about perspective taking. Now, if we fail to do that, you could actually end up with all good intentions trying to express your difficulty to your close friend. You could actually hurt somebody. You could actually be extremely insensitive. These are things that sometimes we need to be a little bit more cautious, and it requires a perspective-taking mindset. I wouldn't say skill, but actually a mindset.
Yeah, but and your point too that how that's related to empathy and perhaps, you know, as Debanjan mentioned earlier too, this whole experience is an opportunity for us to learn to be a bit more empathetic. You know, as well.
I agree with David, and perspective taking has been something which has always been important. You know, I mean, empathy, as David mentioned, is a very different thing altogether. But then today I am at one particular setting, probably a bit safe from, you know, all of us are facing unique challenges due to the pandemic. I mean, considering that many of us work in hospital settings, we ourselves may be at an increased risk, but there might be my colleagues. Let's not even go to the socioeconomic disparities. There are my colleagues who are having to do probably 24 hours duty in a COVID center, you know, and imagine the PPEs being in them, which is quite tough. So there are different challenges. Each nation has its unique challenge, you know. It might be either with the socioeconomic problems, with the diversities of population, economy. I mean, many great economies of the country have been faltering due to COVID. So even though this is there, I think, as David mentioned, having enhanced or a different perspective taking and continuing it probably will be one of the most important lessons of the post-pandemic times. Not only for mental well-being, but overall, I mean, I think in general for the quality of life and well-being.
Yeah, absolutely.
Yeah, if I could, Melissa and Debanjan, to try to link, Melissa's your question on perspective taking to your first opening questions about what has the COVID-19 pandemic actually uncovered. Right, the word uncover suggests to us that the things have been there all along, the problems, and that we were not paying enough attention to it, and now we saw it, and by the time we have seen it, then we realize how serious it is. So you either feel bad, your values come into conflict, or as a policymaker or a leader, you begin to scramble and say, what do we need to do now? And then you have political and social upheavals because now you have to deal with situations that advocacy groups might have been saying, but you haven't been paying attention. But that's the kind of assumption when we say, what are the things that have been there that have been uncovered? I would just like to add that perspective taking, of course, help you to be less surprised because you will be then dealing with some of these things well in advance before COVID. That's number one. Number two, actually, even though the things that are uncovered that has been there, we have to be a bit careful because COVID is a very unique situation. It is global. While it has uncovered things that have always been there, that has been always there, it actually has also discovered new things, things that you and I actually have not thought about. So when the uncovered stuff and the discovered stuff actually happen together. Now, let me give you an example. We tend to talk about the segregation, we talk about digitization, right? That, oh, the people who are poor, the people who are elderly, actually they have been suffering all this. While you digitize, then you realize that actually they do not own a handphone. So we talk about things like that. These are things that you thought uncovered. But what we are not quite aware, actually, it also helps us to discover certain things that we may not have paid enough attention. That is what a smartphone is used for, right? What are the pros and cons about using a smartphone? Has smartphone replaced certain social interactions which are pretty important? So things like that are very important. How does that link to perspective taking? Now, I will use the word, I don't think anybody used that. I will use the word, you need to understand there are vulnerable groups that have been uncovered by the COVID situation.
Yes.
But I hope by now we have also discovered new vulnerable groups. Yes. The emergent vulnerables. In Singapore, a very good example is that people who are in their late 30s or 40s and even early 50s, right? These people, for example, all along could have been getting a very decent salary, maybe 10,000, 12,000, have a mortgage, have a family, have elderly to look at, have children. And so they are like a sandwich generation, sociologically speaking, but they're doing pretty well in Singapore, in the stable Singapore. But with COVID comes retrenchment. With COVID, you just lost your job that you never expected. You have a small business and your business closed down. You not only lost your job, you have to lose the people that you have been working for 10, 20 years together. Now, that kind of situation actually created, and there are quite thousands of them, created a group of new vulnerables. Why are they vulnerable? They are not just like your fresh graduate who say, well, too bad, I'm going to like take less risk, not in going to entrepreneurship and not start a coffee shop. I'm going to join the civil service, which is more stable. Well, these people are in their 40s. They have a mortgage. They have families to take care of. It is not so simple to say, can you lower your expectations, forget about your 10, 12,000 and go and do a $2,000 job. It doesn't work that way. Because if I do a $2,000 job, my entire day is taken up. Right? I cannot do any other things, and my $2,000 job actually cannot survive because I have to pay the mortgage. And once I pay the mortgage, then how do I look after my parents? So we need to have a perspective-taking mindset, because if we don't put ourselves in the shoes of these new vulnerables, we will have policies, we will be talking insensitively to our colleagues. As a leader in the organization, you may be making demands on somebody who has been doing so well all these years and suddenly find himself or herself in terrible mental well-being because back at home you are coping with this situation. But if as a leader in an organization, we are not sensitive to that because you thought this guy is getting 10,000, right? He's still with us, he should be okay. He might not be okay, or she might not be okay. So perspective taking is very important, and you link it with vulnerable groups, what you not just only uncover, but what you may discover along the way.
And actually, to that point, actually, too, I think, one of the things we have also seen in this pandemic, too, is, in fact, the rise of people really driven to the breaking point by a whole range of different kinds of stressors. I'm just looking at one of the questions, actually, from the chat, too. So, folks, please just, put in your questions for Debanjan and David, too. But, one question is, what kind of help or support can people seek when they are driven to this breaking point? Thoughts?
So, again, a breaking point is a very generic term, as you rightly mentioned. It can vary. The threshold varies at what point do I really feel that I can't take it anymore? It really doesn't depend on, it depends on a multitude of factors. It just doesn't depend on your profession or, maybe where you're staying. It can happen even when you're living with your family. We have come across, so many people who have been there with their families, but they're simply stressed because they do not have the habit of getting entrapped with their families for so long.
Absolutely.
They do not have the habit of staying with, in India, particularly where there is a joint family setup. There have been instances where domestic violence, intimate partner violence has gone up so high, simply because the two members of the couple were not used to staying together. So I guess one of the things is trying and understanding when you're approaching your breaking point, because prevention, as always, is better. So yes. If you feel that, the different kind of stress that we face is starting to get on to you physically and emotionally, in the sense your appetite is getting affected. I mean, this is strictly from a psychiatric or a medical perspective. If you feel that you are losing your weight, you're not feeling like really going out, you're closing yourself alone most of the times of the day, you're not enjoying what you were doing before. One of the very important factors which we have been discussing is having passive death wishes, feeling that it's better I develop the infection and I stay quarantined, or things like that. I think those are the indicators that you need to seek professional help. That's one of the things. And beyond that, I think staying socially connected with at least some people who are your close circles. It might not be everyone. It might not be WhatsApp groups. I'm sure many of us might be frustrated of WhatsApp groups by now, by the amount of messages that we get related to COVID. But it might be someone close to you. For grandparents, it might be the grandchildren. For a newborn, it might be the mother. Yeah. For somebody who is away from their parents, it might be their parents. But trying and sharing the distress, trying and sharing that I'm approaching my breaking point, and identifying what your point might be where you really can't take stress anymore, I think is of paramount importance. Yeah. Because for many, what we are seeing, they feel that they can take it. So, I'll just give you an example of a physician who is otherwise very well settled in life with his family, has no other problem. But every single day when he comes back, he works in a COVID designated hospital. And every single day he feels that I might infect my parents, my wife, and everybody around me. And one particular day, he just didn't return home. You know, he was just in the hospital all day, and he started thinking as to whether this is right or not. But then he has friends who are mental health professionals. He has close circles. None of them really knew this. When it came to light, all of them were like, you know, we all thought that he's taking it so well. And that's probably what happens to all of us. You know, you started with living with the pandemic, and we are living with it. It's been more than 8 months. Yes. I think it's really time for all of us to try and understand that there's going to be a continuum. Yeah. And we have a support with us. It's just that we need to know exactly when do we need to utilize our resources and prevent from going to that point of breaking down.
Yeah, that's so good. Yeah. David, you were going to say something.
Yeah, so your question was how are we aware, are we going to seek help? I think the first thing to remember is that the proportion of if you take the number of people seeking help in any country or any organization, the number of people seeking help divided by the number of people who genuinely needs help, actually that fraction is very, very small. Yes. Right, and for various reasons. Number one is that yes, there is a kind of a stigma, if you like, that of seeking help, especially professional help, is like, oh, I'm not right, you know, I'm mentally unsound and so on, or that I'm vulnerable. And so there is a strong cultural element, especially in East Asian countries, I would say, where you are brought up to think the notion about, you know, I can do it, you know, there's a self-efficacy, you know, you should not go to a stranger and ask for help, you know, unlike a medical situation where you can go to a doctor when you have a medical situation. So there is a little bit of that. But I would say that the fundamental problem is not cultural or that. The fundamental problem is that we ourselves who need to seek help are not aware that we have a problem. Many of the times, the not just clinical psychology or social work, but many other health-related fields tells us that we are not aware that we have that problem. That's number one. Right, so being aware that we have a problem actually is the very first obstacle, and that requires public education, of course, not just from the government, but it requires all of ourselves to look out for each other. Now, yes. If you look out for your neighbors, you look out for your friends, right, and it also requires, I would say, some kind of a mental revolution. You know, a kind of way to institutionalize things. For example, what is there to stop our mainstream media and social media, where you have a lot of traffic, to put on your landing page screen or your first page a little box that says this is the helpline, or some checklist to say go to this website, or do you have this problem? Make us think and make us reflect, right? I think those are important things where it makes you, so that you normalize the issue to reflect and say that I might have a problem. The second point I want to make is that many of us are actually, I would say, like frontline pseudo psychologists and pseudo social workers, right? Because we actually come across people who have problems. Now, a person might come to you to say, I have a financial problem. Then when you probe further that, yes, you probably have a financial problem, but what really bugs you now is actually you have an efficacy problem, you have a responsibility problem over your family, you have a problem of guilt, you have a problem that you cannot manage a situation and you are on the verge of breaking down. Now, those issues generally come in second order, but they are actually fundamentally important. But they typically present itself, say, as a financial issue only. Right, it is a financial issue, but very often the financial is one of several manifestations. So social workers, psychologists are well trained to look up and probe to look at underlying root causes. I would say such training and such kind of thinking is very important for all of us who want to help others, and all of us who are in any profession. It could be you could be a team leader of your work team, right? When you begin to see that your good worker is slacking a little bit, please don't just scold that person, right? Find out what happened. And then when the person starts telling you that, oh, I have a computer breakdown, working from home, I have a connection problem, well, probe further. Is that the only problem? Perhaps the person has a very serious family situation to deal with. Right?
Yeah, absolutely.
Each of us are equally responsible. As David was mentioning, you know, many times we think that feeling or let's say mental health or feeling mentally burdened, that's selectively reserved only for people who are mental health professionals. No, it's not that. Each of us, irrespective of our expertise, profession, every single stakeholder can actually take help or be a helper.
Absolutely.
And if that awareness, what we classically call as KAP, the knowledge, attitude, and practice, if that is improved in the community, you know, then a lot of even this cultural barriers, stigma, these can be mitigated. So I think I really concur with this point of David in that it lies within all of us.
Yeah.
And you don't really need to be a trained mental health professional. It's what we also mention as the gatekeepers. Every single person is worthy of becoming a gatekeeper to
Yes.
prevent from any person going to that point of breaking.
So maybe one of the things that everyone can do on this call is actually to think about, who's in their circle that they can look out for, and perhaps be that gatekeeper too.
Well, in the case of Singapore, the Ministry of Social and Family Development has a national care hotline, right? That we are actually, the ministry have been tracking. So that hotline is for anything that is COVID related. It can be presented as an emotional problem, a financial problem, and so on. And my understanding is that it can be family disputes and all. And many of these problems may come out as very concrete, manifested at, we have a quarrel about who can walk out of the house, or we have a financial problem. But underlying that, in fact, correlated, associated with that are typically a whole host of family and also cognitive and mental issues to deal with. I just want to add on the Debanjan's point about, all of us can do a job, and that was my point too, right? But I also just want to add that there are some issues that are serious ones that as layperson you must refer it to the professionals, and so it is also important to know where the professional helps are available and so on. And very often in between the layperson help, your friends kind of a consolation of each other, versus the real professional help of very serious cases, there is also an intermediate one where you can go to family service centers where there are people who are para-counselors or counselors who may not be like really full-time, but they are still well-equipped and well-trained to diagnose your issues and try to refer you to the right places and so on.
So I hear there's a whole range of different options actually.
Yeah, one of the things to just support this is, so we have been having likewise the COVID helpline by the Ministry of Health and Family Welfare of India. At the same time, many national institutes, out of that two main helplines, the National Institute of Mental Health and Neurosciences, as well as the All India Institute of Medical Sciences, they have had helplines specifically dedicated to mental health problems. And if you really see the crisis calls, it's not always about a so-called quote-unquote psychiatric disorder. It might be, my neighbor has had COVID, I'm panicking, or, my dad has lost the job, or my 70-year-old person, father has gone out and has come back after a while, so whether he has got infected or not. So it ranges between a huge spectrum. And one of the things which possibly is, we are also discussing at the different levels, is if we can integrate these helplines. So the COVID helpline, the women helpline, which caters to call for domestic violence, the Help Age India, the elder abuse helpline, and obviously, the mental health helpline. If this will become a very, probably one of the ways of understanding this gray line between where the professional help is needed and where probably non-professional help can also work. Where I started by telling that there are certain signs which we call as red flag signs. And I think it's very important to understand that feeling vicious of self-harm or feeling suicidal is one of the most important red flag signs which must be treated professionally, or at least needs professional help. And even the lay persons can be trained to understand that what are the things which warrant professional help, so that they can also probably take the other person to the relevant service providers.
Yeah, absolutely.
I should add that we are talking about well-being and quality of life, and in fact, you need not be suicidal or have certain classified psychiatric disorders to feel terrible. You can have very bad well-being, you can have very bad quality of life, and you could perfectly normal, so to speak, if you go to a psychiatrist or go to a clinical psychologist. So we need to differentiate the two issues we are talking about, right? One is that, yes, you need to have this early kind of a warning signs to look out for severe issues of depression, clinical disorders, and so on. But I think there's another whole issue about a whole big masses of population that we should be concerned about. It could be you and I, it could be our loved one, our friends, or it could be some strangers or our co-workers. And then, as I said, it need not be any psychiatric or psychological disorders, but because you have certain mindsets, because you have certain accumulation of negative experiences and emotions and encounters, you could develop a negativity kind of approach to life, to things. And then not only for the next few weeks and months, but for a long, long time into your adult life, you may actually experience very poor quality of life and very bad well-being in terms not only about your way that things are not being satisfied, but also about your emotions, about your meaning in life, and so on. Now, those are the things that we need to look out for, because these are the big messes that your clinical psychologist actually won't touch, or they won't come to. And then they are actually left with nobody if you don't think about these issues.
And mental well-being is much beyond mental disorders. I think a lot of us might face difficulties, but that's one of the problems, you know, that when we really do this so-called scientific surveys, and there are so many surveys being conducted, when we really apply a screener, as David was mentioning, only those people probably cross a certain threshold to be classified as a psychiatric disorder. But while for one such person, there might be, you know, hundreds and thousands of people like us, or like any other person, your next door neighbor, who might be feeling really burdened, but you know, might not be seeking help because he's not a so-called quote unquote suffering from so-called severe mental health disorder. So mental well-being is much a larger scoping, and it's an umbrella thing. So I think that will affect many of us for days to come when we are living with this pandemic.
And it's going to affect your physical health. It's going to affect your job performance. It's going to affect your family relations and your social interactions and so on. So really, we are talking about a concept here that applies to everybody. This is not a forum for the small little group of people who are worried about clinical health.
An ambient and more common kind of conditions. What you're sort of saying.
Again, mental health well-being overall is important. At the same time, you know, the red flag signs are also important, because many people might go to that extent, and then, especially, you know, when I'm talking about Indian context, the understanding of where to draw a line, or where really, as you mentioned, the breaking point. So once the breaking point is reached, obviously things become difficult. So as much as possible, I think, the mental well-being gets compromised to a point probably where the gray line gets dropped. And if we can prevent that, then I think it's really something that all of us can be involved with.
So one of the questions actually coming up, I'm looking at the questions here too, is just really, well, then how do we keep ourselves positive? You know, amidst this time when really you're saying negativity is not just a sort of confined to a sort of small group of people, but it's actually there's this ambient condition. How do we keep ourselves positive then?
Well, I think the first thing about talking about positivity is to understand negativity and negative emotions, right? Let me be very clear, and I kept repeating this. Negative emotions does not equal to negativity. Right? It is okay to feel negative now and then, and sometimes you should and you must feel negative when things are not right, failing which you will not lead to positive individual and collective action. So if you have a corrupt government and you do nothing about it, and you feel good about it, well, then you will be living in the corrupt regime for a long, long time. But that's an example. If you have a very bad organizational leader or very team leader that's abusing his or her power, and then you feel positive about it and you keep quiet, well, then you're going to get worse and worse situation, right? So the negative emotions by itself, it is actually a natural adaptation in reaction to a stimulus that is threatening us, right? And so you become negative. The problem is that when you become negative for no good reasons, when you become negative, no matter what the stimuli is, whether it's right or wrong, if something is +1 or -1, you are still negative. If something is A or not A, you are still negative. Now, what that suggests is that we have accumulated a series of negative encounters, experiences, episodes in our lives, feel negative about it, and then we develop a negativity mindset that is not evidence-based. So when you tell me something, instead of listening to what you say, I look at who you are. Now that is a negativity mindset, right? If Debanjan tells me something and I don't like it, not because of what he say or what his argument is, but because of who he is, and I just form an opinion, then I'm not looking at it from a factual, from an evidence point of view. Now, many of us do that because we have a confirmatory bias. It is a natural thing. It doesn't make it right, but it is natural. So we need to take special effort to reflect and to look out for our own negativity biases, because it will develop negative emotions and experiences. And very quickly, I think to summarize the kind of work that I've been advocating is that one of the most effective way to deal with negativity is to develop positivity, because it is very difficult to be both very positive and very negative at the same time. But if you are not negative, it doesn't mean you are positive. If you are not positive, it doesn't mean you are negative. You surely can be not negative and not positive. So you see, the negative and positive relationship is quite complicated. And because if you can develop positivity to a situation, when you begin to see that you want to help people, when you feel a sense of responsibility, when you feel there is meaning in what you do, and you feel joyful, you feel relieved, you feel grateful, it is very difficult to develop negativity. So instead of trying to sometimes worry too much about, try to reason with negativity, think about situations where we can develop positivity. And the positivity will not only bring down the negativity, it actually lead to positive outcomes, such as a better community, somebody's lives, somebody's quality of life is enhanced because of you, and so on. And by giving, the giver yourself benefit as well. So it will be a very positive cycle that goes on.
Yeah, you're doing my job for me, actually, David. Absolutely.
Yeah, I think just to add to that, all of us question ourselves how to be really positive during this time when all around you, the media, your people, everybody is discussing things which have a, so-called negative theme. One of the first things which I at least personally feel and do is that take a step back, and as I was mentioning, to tell ourselves that it's okay to be tensed. It's okay to be stressed. It's okay if I am having negative thoughts. As David mentioned, having negative thoughts is not equal to negativity. And then try and explore that what keeps me really happy. We talk about the COVID-19, and we always talk about deaths, the job loss, the financial loss, and things like that. What about the other side to it? So many of us have had that time to spend with ourselves, with our family, to nurture new hobbies. I personally have been able to read so many books, watch movies, and we have had that time. So one of the things which often I lightly say, and it's also mentioned in one of my writing, is that to convert loneliness into solitude, to convert distance into connection, and to understand that what are the resources there to support me, and extend your helping hand to the other person as well. That keeps you emotionally connected.
So those are really proactive things that I think each one of us could be about and be intentional about doing it. So it's like you're saying, that so much of this is that reframing and sort of pausing, reflecting, and saying, actually, if I'm feeling terrible about something, what is this telling me about what I could be doing differently? And then just being part of making that part better. I think what this is also kind of surfacing for us now is just people having a lot more honest conversations. People, just talking about what really does bother them, about being lonely, about having, issues with whether it's your spouse or your family member or whatever it happens to, your boss, whatever it happens to be.
Or even with yourself.
Or even with yourself, you're right. And but those authentic and more honest conversations are things which can be fostered actually also by leaders and managers. Can we talk a little bit about what else you think leaders, maybe organizational leaders, or even just leaders in society can do to help foster a climate of greater positivity and resilience in this time?
Well, I think leaders, of course, need to be a role model. There are many leaders, sometimes maybe you and I included, be careful here, we need to reflect too. There are many leaders who are very negative, and you can think about all the negative things. And what that means is that whenever there's a problem, the leaders might tend to think that it's the subordinates or it's the followers, it's everybody's problems except yourself. And that, again, is a human tendency that when things are negative, we tend to externalize and say the cause is due to somebody else and not me. Right? But when things are positive, we tend to say, well, because I'm smart, I made this decision, my policy is good, and so on. So we need to be a bit careful that the leaders themselves should refrain from negative comments, but also reflect that perhaps the negativity could be at least in part caused by you yourself. That's number one. Right? The second thing is that I think leaders have to develop trust. Right? If leaders do not have competence and character, well, how can we then look up to the leaders and talk about, how could you help me with positivity? In fact, you will be the target. You'll be the source of my negativity. But it is very important, therefore, for anyone who wants to be a leader, who are already a leader, who wants to carry on to hold on to positive power so that you can make a difference, make an impact in society or in your organization's well-being. The way to do it is to ask yourself, do you have the competence to deal with the situation at hand? If you don't have the competence, well, it doesn't mean that you must step aside. It means that you need help. You need to seek help. Right? Yeah. And one of our problems is that we think that leaders are invincible. Leader yourself, therefore, are socialized to think that you don't need help. You can solve all the problems in the world. That is total nonsense. Right? The problems in the world cannot be solved by any one country. How can it be solved by any one individual? So many of the situations that we deal with actually requires us to have the humility in various effective ways to seek help, even as leaders, right? By being not only just innovative, by bringing co-opting people into your side, many things that many people may have part of the answers that you yourself don't have. So that humility that requires before you can talk about inclusivity, before you can talk about collaboration, unfortunately, psychological research shows that it's lacking in many leaders. So I think that is something, plus the perspective taking that we talk about. Now, the second C, that competence is one C. The other important C is your character. Right? If you have no integrity, if you don't deliver what you promise, if you don't say what you mean and you don't mean what we say, then people will not have the trust in your benevolence. People will not have your trust in your integrity. So trust has dimensions, trust dimensions are trust in your integrity, trust in your benevolence, and trust in your competence. So you must, as leaders, always watch out for these three. And then you can talk about public communication, public engagement, how to have the operational effective leadership that all the leadership books tells you about. To me, those are second order. Right? You need to first have competence and character and have the humility. And then you can talk about all the little management skills about a good leader and so on.
It reminds me of this one equation of trust that a friend of mine told me the other day. She said, trust is credibility times reliability times relationship divided by self-interest.
I think that's fantastically put.
Amazing,
that's a new
right?
equation.
It really helps.
And my compliments to your friend.
It really helps encapsulate that. Your points around competence, and character, and the denominator is self-interest. If as a leader, you are in it for yourself, as opposed to being there to serve the betterment of others, and even if that means stepping aside, or even if that means kind of saying, hey, I need help, in order to get where we need to go, then that's what we need to do.
And I think this David's point about every leader not having the onus of solving the problem alone is very important, because that's one of the mistakes that leaders at all levels do. It's important to understand that leaders are not superhuman. They are also persons like all of us. And it's okay if they also feel breaking down, or they change the leadership or give it to someone else. One of the very important models on which we all operate is based on social learning. The leaders serve as models. And I think one of the very crucial things, not only during this pandemic, but even when SARS or MERS happened before, or when Ebola happened in Africa, the HIV that we still face in India and many other countries, is that how you express a particular concern. Here again comes the point of negativity. So if, it need not always be it always need not be the top leader of the country or of a state. At every hierarchical level, if you or me, we are leading a small group, and I address the group and I talk about something which gets conveyed in a way that I'm looking at it probably through a negative lens, then obviously the group will be negative too. Yeah. So if I have to generate positivity, one of the things is also trying and expressing and be conscious of what I really discuss and talk about with my group, because people are looking up to me. And at times such as this, when I'm trying to hear out someone whom I look up to, what he or she says or expresses will have a lot to do with my psyche and how I take gauge of a particular situation. So in that way, it's very important. And I think that's something which every level leader needs to keep in mind, including all of us.
Yeah, I think if we define leadership as influence, then each one of us has influence in different spheres.
And it's mutual, yeah.
Yeah, so whether that's your family, whether that's in your school or your workplace, or even on a national or international level, definitely. One question that just came up too is around, in fact, the school context and universities. I mean, you know, so strange for students to graduate on Zoom, right? I mean, and
And have the convocation on Zoom as well.
right? I mean, you know, have your party on Zoom. How does that work, right? But then, you know, just, or even going back, like sometimes some schools have started, some haven't, you know, right? In those instances too. So the question is, what role can schools and universities play to support students and also actually fresh graduates in this context? Any thoughts?
Well, schools and universities are quite different. If you define schools as JC, secondary schools, primary schools, and so on, right? But because when you are dealing with the children and dealing with teenagers, it is quite a different context from undergraduates who are young adults already, right? Yeah. So when you're dealing with schools, I think when you're children and so on, it has to be much more careful. You need a much more structured environment. Schools have a particular ministry that you report to, and then the ministry and the schools need to work very closely together to understand the situations that your children are in, because the children in some sense are, unlike the undergraduates, are less empowered, right? They are a function of their situation, are very much a function of their family. And so things like digitization, things like giving just a laptop at home is not just going to solve the problem. You must figure out what things are. Things like if your parents are actually having great financial situation and financial problems, and actually working from home is going to be quite terrible for the student, because the student will not have a conducive environment to work from home. You might drop out. You might actually undergo several dysfunctions, things that can happen in schools. So schools will have a duty and a responsibility to look out for these telltale signs, right? And as I said, remember, they are not just the children that you happen to know as a teacher who come from the lower income groups. They could very well come from the middle class or upper middle class, or even so what you thought it is a very high in the income group because of certain situations that have happened. In the case of undergraduates, as I said, they are young adults, so this is really quite different. They are entering the adult life. They have taken on their own independence. What we are all concerned, and speaking as a professor in a university, I think it's true of many of my colleagues and my university leaders. What we are very concerned is that they are, in a way, I wouldn't say neither here nor there, they are in a transition period, right? Because unlike you and I, who have been adults for decades, they are young adults. So they are entering life, they're entering the workforce, they are seeing life, so to speak, outside schools or outside education for the very first time. And that transition is very important. First impressions last, right? It's going to make an impact on them. And that's why the world speaks about the danger of a lost generation. You do not want any country and any university wouldn't want to graduate a whole cohort of people when you go into the world with despair, you know, with a negative mindset with a very unhealthy kind of a cynicism. And what you really need, therefore, is to make sure you upskill these people, you train them both with an attitude and a mindset with the very 3 or 4 years you have in the university. And you've got to beef up your career, your vocational counseling units, right? You've got to beef up your team skills. You've got to keep in touch with them, right? Universities, in some sense, have a very, very strong responsibility, just not on building competence, but on building character as well. And you're also building a relationship with your alumni, and get your alumni who have gone through resilient situations to come back and talk to the students. Very often, the students listen to the alumni much more than they listen to the professors, because the professors, due to age, is a little bit far removed compared to the alumni who just graduated, where your perspective taking is probably more accurate.
Yeah. You know, one thing. Go ahead. Sorry, go ahead.
No, sure. Please, Melissa.
No, I was just going to say that one thing that I have observed, though, you know, in this whole season actually is just a burgeoning kind of spirit of innovation and creativity. Yeah. That, you know, so for example, people always say, oh, Singaporeans, you're like not creative at all. You can't, you know, you're good followers, you're very efficient bureaucrats and things like that, but we can't really be very creative. And I actually really beg to differ. And I think that, you know, in so many ways, the hardship, frankly, you know, and the difficulties posed by COVID have actually been that, necessity is the mother of invention, right? So, a catalyst in some ways to actually, so I wondered, David, if another perspective, on the fresh graduates now is actually that we might get the best generation ever, because they learn to sink or swim, and they will, and we hope.
Again, if that takes us back to the theme, living with the pandemic. So that's what they're doing.
Yeah.
Well, the answer is actually the answer to your question about whether, in fact, the graduating cohort from universities, for example, or for any institution who enter the workforce is actually going to be one of the best cohorts. The answer is we don't know, right? Because if you belong to a country whereby you just live and die, and all you care about is okay, let's restart the economy, or how am I going to reduce the cases, and you do nothing else. Of course, few countries do that, but some do. And you do nothing else, then these people are left on their own. And with the masses that you graduate, even though a proportion like 30% who's going to suffer tremendously is a huge number for any country, even a small country like Singapore. So I would say we don't take it for granted, and we don't know the direction, just like trust, we don't know whether they will do well or not do well. But what I know for sure is that we do nothing, and if we don't pay attention, I think there will be huge groups of people who is not going to do well, and who's going to develop negative mindsets, and who actually, even with positive mindsets, but without the training attitude, the learning orientation, and the skills, is not going to do well. So I would say that the good thing about young people is that you have time. The good thing about young people is that you have not bought your flat, you don't have a mortgage. Right? The good thing about young people is that you have not married yet, so you don't have a family. Your responsibilities are different. So you are a little bit more less risk averse. You are more risk taking. But because of the COVID, most people now will not say, "Oh, let's go and start my own business," because it doesn't seem a viable kind of a thing. So what we are concerned, I think we as a country, not just government, should be that the innovation, the creativity that comes with entrepreneurship that we have been talking about, we have to be a bit careful, because right now it is kind of in your face that it doesn't make sense, to start your own business. It doesn't mean you should not have innovation or entrepreneurship. It just means that practically the examples you give, the kind of connections that you build is going to be quite different. And how they're going to do well, how they're going to do badly, will depend a lot on their adaptability and resilience, their social support, as well as government policies. Because in Singapore, government policies dominate, right? Government policies determine a lot of business directions. Right? Government typically doesn't intervene with business market forces, but it sets the what you can and cannot do, and the regulations somehow will provide the environment either conducive or constraining for the business to develop in one direction. So everybody kind of need to work together, and I think on the issue of well-being, it is very economically important that we pay attention to the graduating, not just the graduating cohort, but the subsequent graduating cohorts. What does that mean for them? That's another, I would say, emergent groups. I wouldn't call them vulnerable, but emergent groups of concern that we need to pay more attention to. The worst part in Singapore are those people who are not rich and not poor. If you are rich, you can take care of yourself, right? Or you may have your own sets of problems. When you are poor and very poor, you actually won't fall through the cracks, because there are many different kinds of help that look out for you. When you are neither here nor there, and then you collapse and you fall off a cliff. Now, those are the situations that you do not qualify for certain help because of the criteria. So those criteria need to be a bit more dynamic. And then we need to find out ways how to uphold these people, besides giving them training opportunities and skills. First, identify these groups of people that really need our help, and have a kind of a system, have a kind of a industry transformation that is sustained and sustainable. I think those are very difficult issues that government and business leaders have to deal with.
I think one of the things, Melissa, where you originally started the question as to the role of schools and universities in this scenario. And as David pointed out that, an infrastructure is very important. Irrespective of the country or the nation we are talking about, I think that these two bodies have an immense role, going back to our leadership concern, to model, as to how basically organizations should act. Even though they operate on a very different premise, if you see that education, it's not just the sole job of schools and universities. It has to integrate the teachers, the students, the workforce, the infrastructure. Education itself has been a major challenge. E-learning itself is an unprecedented. So when we basically discuss with our child psychology and psychiatry colleagues, we often feel that I think schools, universities, and colleges face a real tough time, irrespective of the country, because they have to cater to the students, the need of the teachers, the economic part of it, the financial part of it, the infrastructure, what's going to happen to exams, a great uncertainty about courses, people who are graduating fine, people who couldn't. Courses have been shifted, delayed by 6 months, 1 year. Imagine people who thought they would already be able to join a job. For many countries, a huge population is looking up to finish their graduation and join a job, which gets postponed by months altogether. And then there's a big question mark. So I think the role of universities is not only serves as a modeling factor, but as you mentioned, a lot of innovations, a lot of changing the course patterns, making courses flexible, making education flexible, catering to the need of the students, catering to the need of the resilience of both the students and the teachers, are lessons which probably, you know, will help them irrespective of whether there is a pandemic. And even though it's something worth researching, but I think I'd always like to still hope that certain flexibilities invested by the schools, universities, and colleges during this time can stand as models for education in times to come, which might serve as quite good.
Yeah, absolutely. I think that the whole point around just adaptability and resilience, right? How do we continue to infuse and take the best of what this crisis, in a sense, has given us?
I still remember one of the maths teachers trying to explain to me how difficult it is to put formulas on online learning, or imagine, for an example, medical anatomy. You know, how online learning can be so challenging. But then there also have been protocols, virtual reality, artificial intelligence, things which have they keep coming up. In fact, one of the most interesting thing was one of the Indian Institute of Technologies came up with a completely virtual yet animated convocation, simulating every single student when they come to take their award. So I think, you know, there are things that which we are also seeing probably due to pandemic, which shows that how creative and resilient a human mind can be.
Absolutely. You know, there's that joke, right? Who drove digital transformation in your company? It's like CEO, CTO, COVID, right? It's very clear. It's like, yep, COVID. You know, everybody has been forced to kind of change. So I have one last question before our summary question for all of you too, which will be around, you know, as individuals, you know, what can we do to change? So that'll be our summary question later on. But actually, we have one question which is the views of irreversible changes related to the pandemic. And because I think we talked about positivity, we talked about hope, I'm actually going to, if you just, you know, will permit me, anonymous attendee, to ask, what is one irreversible change for the better, you know, that you hope for coming out of this?
Well, I think this is going to sound a bit philosophical, but actually it is not. I think what it does to many people of different segments, and all, when things are, I would say, stabilized. Stabilized doesn't mean that there's no problem, right? Cases can still go up and down, but it's no longer as surprising as before, when you can get a sense of what post-pandemic, the pandemic realities, the various scenarios are likely to be. So by stabilized, I don't mean no change. By stabilized, I mean that the initial months of uncertainty develop a particular approach to life, so to speak. I think what it changes is going to be for most of us, right, every one of different segments, to ask ourselves what is our meaning in life. Not meaning about life or meaning of life, you know, which is a more religious and philosophical question about your own personal sense of meaning in life. What matters to you? You will begin to realize that because of the need to adapt, what we are being thrown into an unfamiliar situation, you have to prioritize. Not plan and organize in the comfort of your office, you know, write an academic paper where you have months to do, but to actually act on the spot. Now, when we do things that we have to solve and act on the spot, our values, our attitudes just emerge very often beyond our control, right? We begin to see who we really are. We begin to see who our friends are, who our leaders are, who our followers are, what kind of organization I'm in, and so on. There will be very positive things, but there will also be very negative things, as we have mentioned, how to then develop the positivity and so on. But what I hope that the positive things that can happen to everybody, leaders or not, is to ask yourself what is the meaningful impact, the difference that you want to make, both to yourself, your families, your close ones, and the people you lead, the society at large. And if you are a leader, I think it is a good time to reflect, whether the kinds of value styles and communications that are guiding you all this while, probably it's about time to change. If they are not as effective as you thought they should be or they could be. And so I think that personal sense of meaning is going to be very important. And why I'm more optimistic that the effect is going to happen, unlike, say, in the Christmas 26 tsunami. Now, remember that during tsunami, when it happens about, was it like 17 years ago, right? I think it was 2004 or something. When that happens, there was about 250,000 people who just died overnight like that, right, across countries. So it was a global catastrophe. Now we are in a global catastrophe. You have probably about 1 million of people who just died in the last few months. So the situation is quite different, not just because of the number of people who died is about 5 times the tsunami, but because tsunami is a one-time event. Now, if you recall in tsunami, many of us who were still already adults at that time, right? Immediately after tsunami, we ask ourselves, what's the meaning of life or meaning in life? Why am I here? Should I worry less about buying the nice car? Should I worry about other things? But the mortality salient didn't stay with us for very long. Within weeks and some of us months, we are back to normal. We are back to our daily rat race and so on. Now it's going to be different. Right now, because this is protracted, it come and go, the number of people that it affected is multifaceted and across all parts of our lives. And you get reminded of it every day henceforth. And I hope that unlike the tsunami situation, which make all of us wonder about our meaning in life so that we live a better life and to affect others, this time round, I hope that it will really change us for the better in a sustained and a sustainable way.
Fantastic. Debanjan, your thought.
I just replied by telling 5S. So I feel the changes that, at least personally, what works for me, and I think it happens for a lot of us, one will be solitude, trying to understand, spending time with yourself, which brings us to self-reflection, sustainability, which involves trying and understanding your resources, seeing the unseen, what has been covered, what has been uncovered. Probably a lot of things which were always important came right in front of our eyes, courtesy COVID. And finally, something that resonates exactly what David said, a sense of purpose. I think it's almost resonates same with the meaning of life. But then I think the pandemic, it's been last 8 months. We don't know how long it's going to stay with us, whether it's going to come in waves again. All those things are questions to be answered. But definitely, for the better or not, something is going to change in each one of us in terms of our thoughts, our reflections, our lifestyle, the structure. One of the major things that's going to change is trying and understanding the work-life balance, the work-person balance, and having or appreciating the importance that time has, because it again might sound a bit esoteric, but right when 2020 began, the millions of people who are not today anymore never knew that this is what's going to happen with them. Their family members never knew. So one thing which really, really makes me at least reflect is the value and importance of time and utilizing your sense of purpose as long as you exist. And that's going to be probably one, you call it philosophical, you call it esoteric, you call it, probably more in spiritualistic terms, but that's the harsh reality. That's what the pandemic is going to be, and living with pandemic is going to be about.
And may it do us all good. So
yeah, let's hope for that.
Absolutely. Final concluding question, actually. So if we're going to take one takeaway that you'd like to offer everyone who's been with us now about what's the most important thing we can do as individuals as we live with COVID-19. Who would like to start?
I'll start. I think there is no one answer, obviously, right? It depends on your sphere of influence. It depends on who you are, where you are, and in a particular time. I think what is common to everybody is that never take things for granted. What has worked in the past may not continue to work in future. When you have a group of people who used to trust you a lot, it doesn't mean the group of people will continue to trust you, because trust, to add to Melissa's earlier trust equation, is that actually it is malleable and the weights of all the variables can change over time. So we need to watch out for all that. Things are pretty dynamic. As to what really, I think, regardless of who you are, I think what matters to every one of us is to realize that actually we need that psychological capital for us to function, for us to adapt, right? The psychological capital is actually a scientific research kind of a concept, right? It consists of 4 dimensions: self-efficacy, the belief that you can make a difference, that you can make things change, right? And optimism, right? Able to see things from a brighter side of perspective based on evidence. And hope, right? The belief that things are going to change, so you progress towards your goal. And then finally, to have your efficacy, to have your optimism, to have your hope, and then to have your resilience, because negative things are going to happen, and then how are you going to bounce back and so on. So I think what the takeaway for all of us is that no matter who you are, even though you're pretty comfortable during COVID situation, there will be times where you find that you have to adjust and adapt drastically. And the psychological capital is not something that you open up your phone and produce it. It's something that you develop over time. So the sense of self-efficacy, optimism, hope, and resilience is something that I hope that we can all start developing, and also help the people around us to develop. And then it might be a difficult world moving forward, but I think we then can do well and also impact others positively.
Yeah. Well, thank you, David. From an efficacy standpoint, you made a positive difference to me this evening. So, and I hope so for the rest of our participants too. Debanjan, what's your one takeaway for everyone?
Yeah. So again, the takeaway will is, it can be very individualistic, but then I'd like to say that if the pandemic has made any of us or all of us take 2 steps back on any ground, might be grief, loneliness, separation, segregation, finance, economy, education, anything. That doesn't mean that we cannot take the 3 steps forward. This resilience is infinite. And I strongly believe, just not because I'm a mental professional, but I'm sure David and you will agree with me on this, that humanity has a strange ability to bounce back every time it's hit with any sort of calamity. And that's infinite. So if we can really trust our psychological resilience, the virus will eventually leave sooner or later. But certain effects it produces in all of us, the changes, the positive changes that we were talking about a few minutes back, are some things that we will carry forward irrespective of the pandemic. And just one thing to add, I wanted to mention it somewhere in the session, but at least let me mention it now. There is a strange need for information that has been uncovered in all of us. And that's right from the first day that COVID was declared as a pandemic. The need to know, the need to gather data, and with information came in lots and lots of misinformation. So that's one thing probably, people talk about digital detox and things like that. I'll not go into depths of that, but at least one thing which we can carry forward from this pandemic is that need to know is all right. It's something which is basic to all of us, but it's also important to authenticate and contextualize what you need to know. Otherwise, it becomes an information pollution and overload, which further perturbs your mental well-being. So let that be one of the things which can be highlighted. Probably, again, it's always been there, but then this 8 months at least has taught me this, that information is important, but it can be disastrous at the same time.
That's such good, wise advice, actually, to really just help us all inoculate ourselves as we pause, reflect, and take those 3 steps forward. So thank you so very much, Debanjan. Thank you so much, David, for being with us today. Just thank you all the participants who've joined us in today's webinar. So thank you.
Thank you all. Thanks, David.
Thank you. Thanks, Debanjan. Thanks,
I'll hand it back to Ashif.
Thanks, Melissa.
Thank you,
Thanks
Melissa.
for the organizers.
Thank you, Melissa, Debanjan, and David for the insightful conversation. And thank you again, everyone, for your participation. As part of today's conversation, we have specially put together a resource guide where you can access it through this QR code and the link that we are putting up as a slide and as well as in the chat box. All right, once again, thank you for your participation, and we look forward to seeing you tomorrow at 11 a.m. Singapore time for the third conversation on changes in the arts scene.